Elephantiasis, commonly known as lymphatic filariasis, is a very rare condition that's spread by mosquitoes. It is extremely painful, debilitating, and disfiguring disease. More than 40 million sufferers of elephantiasis are seriously incapacitated and disfigured from the disease. The global baseline estimate of people affected by lymphatic filariasis was 25 million men with hydrocele and over 15 million people with lymphedema. This disease is found mainly in tropical and subtropical climates including Africa and Southeast Asia. It is estimated that 120 million people have elephantiasis. More than a billion people around the globe, which is 18% of the world's population, are at risk for contracting elephantiasis.
What causes elephantiasis? It is caused by infection with parasites classified as nematodes, and they are transmitted by mosquitoes. Before we proceed to how this infection is transmitted, let us see the type of these filarial worms. The first one is Wuchereria bronchophthiae, which is responsible for the 90% of the case, and the second one is Burgia malayi and Burgia timori. Meanwhile, there are also three types of mosquito that transmit these parasites, such as Culex mosquitoes, Anopheles, and also Aedes. This infection is transmitted via female mosquito. It initiates when the mosquito feeds on human blood and the filarial worms penetrate the skin through the bite wound. From here, the larvae migrate to the lymphatic system. Within 9 to 14 days, the larva transforms into elongated form. For the next 6 to 12 months, the larva grow into adult worm. When these filarial worms block lymphatic vessels, fluid tend to accumulate in peripheral tissue. This fluid accumulation causes the enlargement of various appendages, or we call it as elephantiasis. The adults mate and produce microfilariae, which move into lymph and blood vessels, where they actively secrete. In fact, the worms can live for approximately 6 to 8 years, and during their lifetime, they will produce more and more microfilariae. The cycle begins when mosquito ingests human's blood containing microfilariae. There, the microfilariae mature into infective stage larva L3, and it continues to transmit to another host, which is human.
Next, we move to the signs and symptoms of elephantiasis. The most common symptom of elephantiasis is swelling of the body parts. The swelling tends to happen in the legs, genital area, breast, and arms. The legs are the most commonly affected area. The swelling and enlargement of body parts can lead to pain and mobility issues. Other than that, the skin is also affected and may be dry, thick, ulcerated, darker, and pitted. Some people experience additional symptoms such as fever and chills. Elephantiasis affects the immune system. People with this condition are also at increased risk for the secondary infection. Elephantiasis is closely associated with poverty, as those with severe symptoms are often unable to work. They may also suffer significant social stigma as a result of their disfigurement. Many are ostracized or even shunned by the community. 1/3 of those infected live in India, 1/3 in Africa, and the remainder in South Asia, the Pacific, and the Americas. These are some of the examples of real cases of elephantiasis. This African woman is suffering from elephantiasis and is unable to work. She is condemned to live in pain and poverty due to this disease. Her family is at significant risk of contracting elephantiasis like her. Without intervention, this family and millions like them will be trapped in the cycle of poor health and poverty.
So, what are the treatments for elephantiasis? People with an active infection can take medicines to treat elephantiasis. When you have elephantiasis, your doctor will prescribe you to take medicine called diethylcarbamazine, which is known as DEC. You'll take it once a year. It will kill the microscopic worms in your bloodstream. Another way to treat elephantiasis is to use DEC in combination with a medicine called ivermectin. This is also taken once a year, and the combination has shown better long-term results. However, not everyone with elephantiasis will need medication. This is because they may no longer carry the worms in their system despite the presence of symptoms. There are some things you can do on your own to ease them from swelling. First, wash and dry the swollen areas daily. Second, apply moisturizers to swollen areas. Third, check for wounds and use medicated cream on any sore spots. Next, exercise and walk when possible. Other than that, if your arms or legs are swollen, keep them elevated when you're lying down or seated. And lastly, you may also be able to wrap the affected areas tightly to prevent them from getting worse. But you should check with your doctor first before doing so. Surgery may be recommended in rare cases to remove damaged lymphatic tissue or to relieve pressure in certain areas, such as the scrotum.